Today, we are joined again by Ginny of the Women's Health RN. She has become a dear friend in the women's health space as we both navigate running businesses, growing families, and literally growing babies because we are both pregnant and due in the month of December, as this is releasing in December at the beginning of the month. So we will see when these little babies actually make their appearances. But we last talked, she was on episode 11 of the Holistically Well podcast, and that conversation was really centered around PCOS, but we also discussed miscarriage, and Ginny had unfortunately been through a miscarriage shortly before the recording of that episode, and then we both found out and expressed to each other that we were very newly pregnant when we recorded that episode, and both had it announced it. We both hadn't had doctor's appointments or midwife appointments at that point. Like, it was very, very new. So it's really fun today to be sitting down as we are just moving through motherhood and entrepreneurship and all the women's health things.
Yes, I am so excited and honored to be back. It is always so fun to chat, and I just love how our conversation flows. We could talk for like 8 hours, but we'll limit it to not that.
Yeah, we'll keep it under an hour, don't worry. Today's conversation topic is going to be PMS, painful and heavy periods. So if you are on the side of things where you're struggling with PCOS or miscarriage, definitely go back and listen to episode 11. We covered those two topics more at length there. But today we're going to dive into PMS, painful periods, heavy periods, how to relieve those, how to get to the root cause, and what your doctor may be missing. So Ginny is a registered nurse, but can you also talk about your extended background and more of like the functional nutrition space and how you got into doing this work?
Yeah, in addition to being a registered nurse, I spent a lot of my clinical experience as a registered nurse in restorative reproductive medicine, so learning deep dives into hormone physiology that went way beyond just conventional OBGYN work of like take birth control for any women's health concern. And then in addition to that, I went and got my master's degree in nutrition and functional medicine. And that gave me a very deep groundwork of why are these women's health issues occurring and how to connect hormone imbalances to deeper underlying root causes in the body, like blood sugar imbalances, inflammation, a lot of things we'll talk about today. And since then, I've probably taken about 5 to 8 plus continuing education courses for deep learning into how to interpret blood chemistry in a deeper analysis, how to interpret GI map, and then I've continued my education in all things hormones to really understand, again, very deeply how hormone physiology is tied to the root causes that I always talk about. And so that's what we'll really dive into today is, with PMS and heavy periods, while this can seem like a hormone issue, it's really much deeper than that.
Absolutely. So, Ginny, let's start with redefining normal. So many women are told that PMS and painful periods are normal. Like, it is just a normal part of being a woman. So what is the difference between what's common and what is truly normal when it comes to our periods?
Yes, I love that. And I will say I loathe deeply all of the memes on Instagram that are like, oh, when my husband like doesn't recognize me like the week before my period, or like, when I'm just a like raging lunatic the week before my period. That's not normal. Okay. We can start by saying that. All of those memes are normalizing PMS, which is common, but not normal, right? That's really, really important distinction. And so what we like to see around your period is that your hormones are dropping prior to menstruation. And it's okay to have a little bit of mood shifts, maybe be a little bit more tired. You may notice, if you're very in tune with your body, those little shifts, okay? But it is not normal to have extensive rage, moodiness, like you are going to snap at someone at the drop of a hat. If you're dealing with premenstrual headaches or migraines, that's not normal. If you're having cramps before your menstruation and then cramps during menstruation, which you cannot continue with your daily, daily activity living. Like, you can't continue cleaning your house. Like, you have to be on the couch. You have to have your heating pad. I always tell people, like, we are women and we are going to be shedding our uterine lining during menstruation. It's okay to feel that a little bit, right? You do have to have that contractions to get that blood out. So it's okay to feel that a little bit and have mild discomfort. So I would say mild discomfort, but nothing that is needing an ibuprofen, definitely several ibuprofens to manage. You have to be tied to your couch. You're definitely not, if you're having nausea or vomiting from how intense the pain is, those would be all red flags that what you're experiencing is beyond normal. I would say very extensive bloating or breast tenderness prior to menstruation would also be in a bit of the realm of not normal. I'd say a little bit of bloating is okay, but like if you're like extremely uncomfortable from how bloated you are, that would be not normal as well. So I would say really if your symptoms, to put it very generically, like if your symptoms are disrupting your life, right? If it's causing that disruption in your relationships, in your ability to function at work, that's beyond what is normal. Does that all make sense?
Yes, for sure. And, you know, we all have friends who have shared, like, I had to stay home from school whenever I got my period in high school, or I can't go into work whenever I get my period. Like, that is not normal. But even if it is affecting, like, your ability to perform your job duties or to do your schoolwork, like, that is probably not normal and would be worth looking into. So, the physiology of a woman's cycle. What are some of the main root causes that you see behind PMS and these painful cycles?
I'll start with like your hormonal kind of influences. So if you have what we call like estrogen dominance, and I have air quotes if you're listening to this, because women can have a relative estrogen dominance to low progesterone. So in the beginning of your cycle and around ovulation, your estrogens should build up. And then after ovulation, we should have this lovely hormone called progesterone increase. And progesterone helps to counteract the effects of estrogen. And estrogen helps to build up our uterine lining. It helps to support optimal cervical mucus, right? It does all these lovely things, but it should be counteracted with enough progesterone. So in women who are having suboptimal ovulation, I think a lot of women with PCOS or maybe conditions like endometriosis where they have this relative estrogen dominance, women who are actually carrying excess fat tissue can actually secrete estrogen. And so if we are also not clearing out estrogen effectively, so this kind of goes into, which we do see a lot in practice, is congested liver or sluggish liver, sluggish bile flow. Your estrogen needs to be cleared out first and foremost through your liver. And then secondly, you need to poop it out. And so we call these like suboptimal detox pathways.
Yes.
So if there's something going on like where the liver is sluggish, it's impaired, and if we have also gut dysfunction, so if you're having constipation, you're not going to be pooping out your estrogen enough, and it can be reabsorbed actually systemically. So we can have a relative estrogen dominance that way. And so if any of these pathways are blocked, we can have a relative estrogen dominance, and that could then lead to some of the PMS symptoms. And then simultaneously, if we are not having an optimal ovulation and then not producing optimal amounts of progesterone post-ovulation, then this could then further lead to estrogen dominance and the symptoms that we just described. Also, this is especially relevant for heavy menstruation as well, because I mentioned that estrogen helps to build up the uterine lining. So if you don't give enough progesterone to counteract that estrogen, or you're not clearing it out effectively, so I say it's hanging out. I always say with estrogen, you want to use it and lose it, right? We want estrogen. She's lovely in her, optimal ranges, but when she's hanging out, it's like that guest who's just like not really getting the message. They're not getting those social cues like it's time to leave now. And so when she's hanging out, then we can see also heavy bleeding, which I'll define as well, that's needing to change a pad tampon every 1 to 2 hours, especially like if you're bleeding through like a super tampon like every 2 hours, that is heavy bleeding. Passing clots larger than a quarter, bleeding longer than 7 days, If you're using a menstrual cup, that would be also losing over 80 milliliters of blood per cycle. And you could add it up. A regular tampon is about 5 milliliters of blood. So if you wanted to
Okay.
go super tampon and add all that up, that would
Yes.
be not normal. And then especially too, if you're losing this blood and you're having a lot of fatigue and mood changes and things like that, it's likely because your iron's getting depleted, and that could be a sign of, too heavy of periods as well. So all that to say is this whole like estrogen, progesterone picture is huge. Now,
Mhm.
right, as I mentioned, the estrogen, while that can be a whole reason why it's happening, it's still not really the root, right? Because it's really the root of, well, why is our estrogen hanging around? The sluggish liver and, the liver congestion and the gut imbalances. And then why are we not having an optimal ovulation? And why are we not having optimal progesterone levels? That oftentimes is going to come from inflammation, nutrient imbalances, and blood sugar dysregulation or insulin resistance. So it's more of those, right? Those root causes that is leading to the hormonal dysfunction that then is leading to the
Mhm.
PMS, the heavy, the painful periods. Did that all connect?
Absolutely. And to the listener, I think it's really helpful how you broke it down, because we as a patient, you feel the outcome. You feel the outcome of these
Yes.
heavy or painful periods. But the why, okay, that's the estrogen dominance. Okay, I'm making more estrogen than progesterone. But why? Well, it's because of these not happy detox pathways, right? Or a sluggish liver or things like that. So there's really layers to these process, and knowing that you have to work through those layers, and sometimes it's not a quick fix, right? But understanding your body as a woman is so important, because we have these monthly cycles that are teaching us something, right? And so to tune into that and to understand if it's something worth looking into for you. So that breaks down the estrogen dominance of estrogen versus a low progesterone, for instance. Do you
Mhm.
ever see where it's just low progesterone is the issue versus like estrogen hanging around too long? Or is it usually where there's always this interplay of the two?
So it's usually an interplay, because if you have low progesterone, well, right, you're not going to counteract that estrogen, even if your estrogen is relatively lower,
Mm-hmm.
right? Because if you're not having a good estrogen rise, right, okay, you're not having healthy ovulation, you're having that low progesterone. So they're typically, so that's why I'd say like the degree of estrogen dominance can change, because, like I said, if you have excess fat tissue or you have endometriosis, like I mentioned, which I would say endometriosis is a topic in and of itself, but for those who don't know what endometriosis is it's when you have endometrial-like tissue growing outside the uterus, so on the ovaries, the bowels, the bladder. And endometriosis, right now, I believe the statistic, it takes about 14 to 18 years to get diagnosed, which is insane. Um, and the thing about, so right now, conventional medicine treatment for endometriosis is birth control, which arguably can actually make endometriosis worse, because it can actually be giving hormones like estrogen that can feed into the endometrial lesions and actually make the inflammation and endometrial lesions worse. It's an ablation surgery, which basically that's when they're trying to burn the endometrial tissue, and that can create actually more inflammation, can cause adhesions, scarring, and actually be cause more painful periods after people have ablation surgery and impact fertility. And then the last treatment option that they have for one with endometriosis is a hysterectomy. So let's just not solve anything. We'll just take it all out. And that doesn't either address, too, if they have endometrial lesions on the bowel or the bladder. So conventional medicine treatment of endometriosis in of itself is extremely poor. For anyone who's like, oh, do I maybe have endometriosis? Some of the really big symptoms of that would be this really painful, heavy menstruation, but also pain with intercourse, pain with bowel movements are some really big signs that you could potentially have endometriosis. So, and this kind of feeds into too, because I would say endometriosis, yes, if you're diagnosed, we definitely want to have special concern in that area, but it still shares the underlying root causes to someone who's having painful, heavy periods, and maybe they don't have endo, right? There's still this underlying issue of this is not a gynecological issue. This is actually more so an immune system and inflammatory disorder with metabolic, gut, and liver involvement.
So interesting.
There's just so much to dive into there. But really, again, at its root, I know back to your question about like the estrogen, the low progesterone. Like I said, those could be like why the symptoms are almost happening, but they're still not the root, right? We have to really say, well, why are you not having an optimal ovulation? Why is estrogen not being cleared out effectively? Which one is it for you? It could be one or the other, it could be both. And that's where we see so much, I would say, I feel like the past month, all I've been seeing is my practice is nutrient deficiencies, poor gut dysfunction, and sluggish liver, or congested liver, however you want to say it. I feel like it's those three main things eating into. I'll say metabolic dysfunction, so insulin resistance kind of married in there too. Those are kind of like the really big root causes that we're seeing feed into it.
Yeah, yeah. And how each person, it can be displayed differently, but it can be trailed back to a similar root cause.
Exactly.
So you mentioned inflammation, and with that I would put like prostaglandins. So let's talk about inflammation and prostaglandins, and thus their contribution to like cramping, clotting for painful periods.
Yes, exactly. So, yeah, your prostaglandins are going to be those big inflammatory compounds that are really stimulating those uterine contractions and pain. Now, I'm going to bring up something you probably didn't know we were going to talk about in this podcast, but also histamine.
Yes.
Because I have been seeing histamine over and over and over again
Okay.
being an issue for PMS and this painful, heavy menstruation. And it's because histamine can be upregulated when there's inflammation and also when there's estrogen dominance. So histamine is a compound that is secreted by your mast cells, which are an immune system type cell. And a lot of people think histamine, they think allergies, right? But it's a signaling molecule in the body that does a lot more than that. And it's actually very helpful. It can actually help, it actually feeds our immune system to fight pathogens. It helps to support healthy stomach acid production. It acts as a neurotransmitter. And because it does these things, when histamine is too high, it can act on so many different receptors in the body and create a lot of symptoms. So I would say, when we're talking about inflammation is such a vague term to me because it's like, well, what inflammatory modulators are you talking about? Histamine could be an inflammatory modulator. You also have other inflammatory cytokines, which have been shown in research to be elevated in those with PMS and heavy painful periods, like interleukin 6, TNF alpha. So those are actually what inflammation is, right? It's your immune system actually making these inflammatory molecules. So I think that's important because I feel like everyone just hears like inflammation.
Right. Like, what is it?
Yeah. So I always think of also like inflammation and this could also be histamine too, as a bucket analogy. Okay. You have things that are filling up your bucket. So like your processed foods, your stress levels, right? Those things that are filling up your inflammatory bucket, and also simultaneously could be filling up your histamine bucket. But we should have also a good drain for that bucket. And that would be, I would think about like your antioxidant, your nutrient status. So your body's ability to clear out and manage inflammation. So when we're having that inflammatory cascade, we have to figure out what is feeding into the inflammation and why are you not combating that inflammation well, right? It's a twofold issue. And I think that's where a lot of people are getting confused when it comes to like, they go to the doctor and the doctor's like, yeah, you just have a lot of inflammation. They're like, well, how do I bring that down? And it's a twofold thing.
Right.
You need to address the drivers of the inflammation, and that could be gut dysbiosis, infections. Again, what you're eating inflammatory foods, disrupting your gut barrier function because your gut's going to be 80% of your immune system. And then you could also be then simultaneously not eating the things to help your body combat inflammation, or doing the things like not getting enough sleep, things that are going to further weaken your immune system. I hope that's making sense and I'm not diving too deep.
No, I think that's great. And we're still, you guys digging into the physiology behind some of the main root causes behind PMS and painful cycles. And so I think it's important to do mini deep dives on each of these categories, right? So we covered estrogen dominance. We just did a little deep dive into some inflammation and what that actually means, and the both reducing the triggers of it, but also improving the pathways of clearing it out. And then let's tap into blood sugar dysregulation and its tie into mood swings specifically there.
Yeah. So with your blood sugar, right? So, going really simple, when you eat your carbohydrates, that's going to increase our blood sugar. And then depending on which carbohydrates we ate and depending on what we balance those carbohydrates with, fat, protein, fiber, helps to slow the absorption of that glucose, and so we have a more steady blood sugar rise. And when you're having unbalanced carbohydrates, it can lead to quicker absorption of that glucose, which leads to a glucose spike, and then it could lead to simultaneously, well, I'd say not time, like you spike and then you can go crashing. And that big spike and crash can cause a lot of mood symptoms. Simultaneously, it can also create inflammation. So I always love to educate people on, because I'll see hypoglycemia as much as I'll also see hyperglycemia. Both states are equally as stressful for your body, because hyperglycemia can really cause cellular damage. That's what's causing that inflammation cascade. But hypoglycemia, when you drop that low blood sugar, and that's when people are feeling shaky, irritable between meals, sometimes really foggy headed. And if you're dropping into hypoglycemic tendencies, that is so stressful. Your body actually produces your stress hormones, norepinephrine and epinephrine, in response to hypoglycemia, because how the body increases your glucose back up is by activating your stress hormones, and your stress hormones then stimulate your body to then create more glucose to stabilize your blood sugar. So do some deep physiology here, but that's also why if you're crashing, you are actually in a stressed state. You are actually in a fight or flight epinephrine, stress state, because that is such a stressful state for your body to be in, is hypoglycemic. I always tell people, your body wants to be as safe as possible. It wants to be in, right, that word homeostasis. Mm-hmm. So whenever you're getting too high in blood sugar, you're going to have inflammation. That's going to directly interfere with hormone processes. And then if you're dropping into hypoglycemia, then that's going to be equally as stressful in your body, but now you're producing all these stress hormones, and then that can feed back to the brain to then also downregulate optimal hormone production, sex hormone production. So you have two different pathways in which how blood sugar dysregulation, high or low, can interfere with healthy hormone activity. And also, again, feed into inflammation. And both of those things, inflammation and hormone imbalances, are going to lead to the PMS, heavy, painful periods.
Yes. So why is blood sugar dysregulation an issue in the hormone cycle? Like why does that typically occur around the time of PMS and thus lead to then the mood swings? But why is blood sugar dysregulation an issue at that time?
So I would actually say it is an issue the whole cycle.
Sure.
Because it's going to feed into the estrogen dominant low progesterone piece.
Okay.
So then that's going to feed into the PMS. So blood sugar is equally as important during your PMS time, period time. You need to build up the pathways or the support the body, the hormones in the follicular and ovulatory phase to have the healthy hormones to reduce your PMS and your periods. Now, in your luteal phase, the phase right before your period, right, the 2 weeks before, progesterone can actually make us a bit more insulin resistant. So it actually can make us more susceptible to blood sugar dysregulation. And so this is also why more women get the cravings. They do get the mood shifts as well because of progesterone worsening insulin resistance. And that's a natural mechanism, because I think this is really important, because then people will be like, oh, that's bad, right? But in pregnancy, it's actually designed that progesterone induces some insulin resistance, because if we were ever in a famine or a low energy availability state, what it's actually doing is making sure that your glucose actually gets to the baby first and foremost. So that is why progesterone does induce a bit of an insulin resistant state, which actually favors us in pregnancy in and not to say the Stone Ages, back then when there used to be famine and things like that.
Yeah.
But now, because we have so much access to food, what we are seeing is now this progesterone, and this is why gestational diabetes also happens at a much higher rate now
Hmm.
because people have higher progesterones in pregnancy, inducing more insulin resistance, and they already went into pregnancy in a glucose dysregulated insulin resistant state, and now that's only going to be worsened and heightened during pregnancy. Um,
Yes.
so that's kind of answering your question. It's like
Mm-hmm.
a both and, like
Mm-hmm.
you need to support glucose and blood sugar throughout your whole cycle, but it gets even more, it gets worse and
Yes.
harder to manage before your period because of that higher progesterone. And then, right, so now you're more insulin resistant and you're not taking care of your blood sugar and your blood sugar spiking more. You're now having more inflammation and now your period's going to be even worse. Does that make
Yes.
sense?
It does. And I'm so glad you broke that down the way you did because I completely agree. Like, we need to regulate our glucose well all of the time. But that answers the question as to why it is more noticeable
Yes.
around our cycle because of the hormone progesterone and its effect on our ability to regulate blood sugar. Like, so interesting, right? So next, let's dive into stress and the HPA axis in terms of how that affects worsening PMS symptoms.
Yeah, so with that, the HPA, the hypothalamic pituitary adrenal axis, but we should really expand that to be the HPATO axis, to be the
Mm.
hypothalamic pituitary adrenal thyroid ovarian axis, as you know. Um,
Yes.
and I haven't even talked about thyroid dysregulation, but I should mention that as we talk about this because suboptimal thyroid function is very well known to be associated with lower progesterone and I would also say heavy bleeding. Not I would say, the research would say. And this is so because it can really interfere with the clotting mechanisms and things like that. So if there is heavy bleeding, if there is low progesterone, if there's PMS, then thyroid should definitely be looked at as well. And so, but going back to your question about stress. So, stress is going to really down regulate our production of our hormones, our sex hormones. So, right, if we are experiencing a lot of stress in our follicular phase, we do see really cool studies showing that in mice, when they induce like physiological stress and psychological stress actually to the mice, you will see a decrease in estrogen and then you will subsequently then see a decrease in progesterone production. So we do know that stress, and I am a really big fan of understanding what stress is to the body. Stress is not just yes, it can be the psychological stress, but I put stress under different buckets. It is whatever is a stressor to your brain and to your body. So under eating, over exercising, or I would say sedentary lifestyle, nutrient deficiencies, gut infections, gut dysbiosis, inflammation, trauma, absolutely. Yes, again, all of your psychological stressors. And then your physiological stressors, like I was saying, the over exercising or not exercising enough, all of those being actually considered under stress, right? This is what our brain is perceiving as stressors to the body. And then I always think about how the brain is just kind of always being like, is it a good time to have a baby right now? Like, do we think that based on what's going on with all of these different, right, the stressors, do we feel like it's a good time? And probably not. If you're nutrient deficient, you're inflamed, blood sugar dysregulation, maybe you got some gut dysbiosis, and on top of that, psychological stress, the body's gonna be like, yeah, no, probably not a good time to have a baby right now. So then we see that we see, and of course, like I said, explaining a lot of the science actually, but we then see a decrease in, our ability to create estrogen, a downregulation in the conversion to estrogen, and then subsequently then we'll see low progesterone. And there's also known as the cortisol steal. So when cortisol is high, cortisol and progesterone are made from the same parent hormone. And the body is always going to prioritize cortisol over progesterone production every time, right? Because it's way more important. Cortisol is way more important for your immune system. Again, it's like your stress hormone. And if there's a stressor going on, your body's absolutely going to prioritize that over little old progesterone.
Mm-hmm.
So if you're definitely experiencing stress independently, like I said, can just interfere with the whole ovulatory process. But independently, especially, it can also interfere with the creation of progesterone because of that cortisol steal mechanism. So that is all of the ways in which stress will negatively impact hormone function. And I'll also add that stress also increases our need for nutrients. So you're burning through your nutrients at a much faster pace. So you're more likely to be dealing with nutrient deficiencies when you're actively under stress. And what do we also do when we're under stress? Because I always talk about with my clients, we are always not prioritizing our healthy things. Like, right? Like when we're under stress, we also tend to lack sleep. We also tend to reach for the not so great food. So sometimes I always say to people, like, is it the stress? Like, is it the mental stress? Or is also your habits that end up happening when you're under stress? And it's most likely a combination of those two things that is then furthering all the hormone dysfunction.
Absolutely. Absolutely. So, in terms of the physiology behind root causes for PMS and painful cycles, we have covered estrogen dominance versus low progesterone and the gut and liver detox pathways to help clear out the estrogen. Okay. Inflammation, prostaglandins, and their effect on cramping and just inflammation in general, the way that our body can feel under that, blood sugar dysregulation and its tied to mood swings, stress, and thus the worsening of PMS symptoms. And then just as a side comment from a physical therapy perspective, I will see people come in during their period and they're like, oh, I'm extra achy and painful today. Like this can show up throughout our entire body, right? So sometimes it's not just a crampy feeling in your abdomen area, but you may notice musculoskeletal factors such as our pelvic alignment can be more off. You may have pain in your hips or your low back. The low back is like a very common area, or your neck, like headaches, migraines can all be triggered by this root cause pathway. And those are things that I tap into as a physical therapist to address the symptoms that are coming from these root causes, right? But then as a holistic PT, we're diving into, okay, well then why is this happening, right? Why is it happening where every single month we're getting a headache? So that we're not only dry needling it and helping you feel better in the moment, but we can also proactively prevent this from happening again the next month. So just really a full picture look for you there.
Love it. It's so important.
Yes.
All of it.
Yes. So how does PMS and painful periods, this category that we're talking about, how does it connect to the broader hormone health like thyroid or fertility?
Yeah, so usually your PMS and your painful heavy periods are more of, right, it's the symptom of the hormonal dysfunction, right? So that should be your clue to be looking into those deeper things like thyroid and those root causes that we talked about. And then I would consider it as a red flag for fertility, right? So if you're experiencing PMS and painful periods, well, this is a huge sign that things aren't functioning optimally, right? Hormones are likely not functioning optimally. And then, right, those deeper systems of the body's blood sugar, nutrients, liver, gut are most likely not functioning optimally. And we see all of those. If you have disrupted hormonal activity, well, absolutely there's going to be a fertility concern. But those root causes we see, inflammation has been independently linked to infertility, right? Infertility issues, right? And increased risk for miscarriage, right? So we see that, number one, the hormone dysfunction in and of itself, low progesterone can be a reason for inability to conceive or miscarriage. But then independently, those root causes, blood sugar dysregulation, we see in the research, those be independent risk factors for infertility and miscarriage. Does that make sense?
It does. It does. And I think this is why cycle health is a vital sign, is a woman's fifth vital sign, because it gives us early warning signs that something is off. And oftentimes this occurs in high school and in college for individuals, right? And in episode 11, Ginny and I both touched on our history of having really the opposite end of things, where we weren't having regular cycles, we were having reduced cycles, spaced out cycles, that type of thing. So, there's very different ends of this spectrum, but either way, it's giving you an indicator that something's off with your hormone health. And this is why we wanted to do a deep dive into this side of things, where we're having those really heavy, those really painful periods, because it is your body telling you on the early end. Hopefully we're recognizing, okay, something's off. I want to get pregnant someday. I want to conceive someday. I want to be in optimal health now. It's time to address these, right? So for the woman who is listening, who is struggling every month, what can she do right now to find relief and start addressing these root causes?
Yeah, so I would say one of the big things we can think of is, okay, how are we going to decrease the inflammation, the blood sugar dysregulation? How can we decrease that side of the bucket? So, right, really reducing our refined and processed carbohydrates, the white breads, cookies, and things like that. And I think also a key word that I just always like to highlight is reduce. We don't need to completely eliminate, we just need to reduce them, okay? um, I will say people will see me also talk about like seed oils and on my page and how I'm like, oh, they're not like inherently inflammatory. However, when they're overconsumed, they can promote inflammation by negatively impacting our balance of omega-3 to omega-6 fatty acids. They can decrease our vitamin E, which can then disrupt cellular membranes, which then makes us more susceptible for inflammation. So I would say really reducing the processed foods, and typically when you do that, you will also reduce the seed oil simultaneously. Trans fat, very well known to be associated with PMS, inflammation, and all those things. So I would say most things have cut out trans fat from this day and age, but if you're still eating anything with trans fat, which you can check on the nutrient label, please discontinue eating that. Typically, I could also see excess gluten in corn products that can disrupt our gut barrier. And typically, it's more of like the lower quality, again, kind of processed foods, the white bread, the tortilla chips, those things that can both irritate our gut lining, which will then worsen nutrient absorption and then also potentially feed into inflammation. That's something we should also be careful with, I would say, with just also too, like, I would say dairy alternatives, like a lot of those dairy alternatives are also filled with a lot of like fillers and just like not super great ingredients that can lead to also gut disruption. So if you think of, if you're disrupting anything in the gut, you're going to really disrupt your nutrient absorption and also disrupt or cause inflammation essentially. And then I would say alcohol, caffeine. Oh my goodness. Yes, please reduce those. I'm pretty much on the wave of like, technically there is no safe amount of alcohol. There's pretty much no alcohol that you're just be like, thumbs up, that's great for you. Alcohol is processed as a poison by our body. It is processed by a poison by our liver. So especially if we're talking about liver congestion, alcohol is doing you absolutely no favors. I mean, I would say it kind of course, depends where someone's starting out in their alcohol intake. Generally, the less is better. I really would say no more than 1 to 2 drinks per week, in my professional opinion. Caffeine, I generally am going to limit it to about 1 to 2 cups of coffee a day for caffeine intake. And then maybe if you equivalent, I mean, I really don't love energy drinks because people usually having that in addition to coffee.
Right.
And it's usually a deeper sign, why do you need that energy drink?
Right.
That's usually blood sugar dysregulation, nutrient deficiencies, like iron deficiency. Why are you so fatigued that you need an energy drink? And then they usually are coming with like sugar alcohols and things like that will further disrupt our gut. So I'm not against coffee or matcha. I think they're really great and they actually can stimulate like coffee can stimulate bile flow. So that's actually a good thing. But we just want to have everything, in moderation in that standpoint. So those are kind of the big things that I would be saying, hey, we want to reduce those to decrease our inflammation, histamine, all that bucket.
Yes.
And then simultaneously to help to support the drain of the bucket, so increasing our antioxidants, that would be increasing your omega-3 rich foods, like going to be like your fatty fish, flax, chia seeds, walnuts. Definitely balancing our blood sugar, so pairing all of your meals with I would say anchoring your meals in a protein source, and then a carbohydrate that naturally contains fiber, so your fruits, your root veggies, and then increasing your antioxidant rich foods. So I just mentioned fruit, that's going to be one of the big ones, and then the other one is your veggies. I mean, we're just really not eating enough veggies. Those are going to really increase your antioxidant capacity. So I say up to 6 servings of both like fruits and veggies in your day. And I review so many diet and lifestyle food journals. And most times when people come to me eating clean, that means they're avoiding maybe the, processed foods, but they are still not getting that upwards of 6 to 7 servings of fruits and veggies a day. I used to see that lacking over and over again. And then really increasing mineral-rich foods as well. Bone broth, beef liver, pumpkin seeds, dark leafy greens. Those are some of the big ones that I think about to also just increase your nutrient density. The last one I'll say is also just iron-rich foods and pairing that with vitamin C for optimal absorption. So vitamin C being like berries, broccoli, and then iron-rich foods being like your red meat's going to be probably your best source, and then lentil, spinach, lesser rich or bioavailable sources of iron. So that would be kind of where to start from a diet standpoint.
Yes. What about from a lifestyle standpoint?
So from a lifestyle, I hate like just stress less. I feel like you probably see me talk about this all the time, but it just really bothers me because it's just really not practical.
Yeah.
I just say, how can we support your nervous system better? Like, can we add in more breath work, more pausing throughout your day? Can you shut off your screens more? So less blue light exposure, more sunlight exposure, especially at nighttime, so we can really decrease cortisol and increase our melatonin. If you're having a lot of blue light screens, so like your phone, your laptop, TV, you're going to block your melatonin production at night. And melatonin is actually one of the major antioxidants in the body. And I think that's actually a huge, huge reason for so much immune system dysregulation and chronic inflammation in our society right now, because of how much we are not supporting optimal sleep and melatonin production. And that's just going to really, again, really negatively impact the whole system. Getting off screens like 1 to 2 hours before bed. I know like no one does it. I don't even do it. I work a ton. And so I have blue light blocking glasses, but I also have the crazy amber glasses. So blue light glasses help to filter out blue light, whereas amber like completely blocks out blue light. So you look like the crazy red glasses.
Right.
I do have those, and again, free. Stop being on your screen and read a book. That's free.
Yeah.
But if you are someone, like myself, I have to work at night. It's just my reality right now. And so I will wear my amber glasses at night to help to, support those pathways. So I'd say those are kind of the really big ones I think about. Instead of just being like, hey, stress less, I think about how can you optimize your sleep, optimize your sunlight exposure. In the morning will be the best time. Like if you're like, okay, I can only get sunlight one time a day, I would choose the morning, because that's going to really set the hormone systems for the rest of your day. It's really going to prime your brain, your cortisol levels to be healthier for the rest of the day. And then I would consider everything else a bonus, just as much as possible, truly.
Yes.
And that doesn't mean directly also in the sun. That literally means like you can go sit out in the shade. Right? Like if we're in like a dark house versus if you even go outside when it's cloudy, it is still so much brighter. Right? It's not artificial light. It is, your eyes have photoreceptors and they perceive so much, and it feeds into so many hormonal signals. So that's what I would say from like my biggest thing I'd say from a lifestyle is like the sunlight and the blue light in the sleep picture is arguably one of the most important places you could start, in my opinion. And then the second and third things would be movement, to support blood sugar, support lean muscle mass. I can't imagine how much you probably love lean muscle.
Yes.
I always say though, lean muscle is like your ticket to blood sugar stability, because muscle uptakes 80% of glucose. So the less lean muscle you have, the less place you have glucose to go, which will lead to increased insulin spikes. So the more lean muscle mass you can build, it truly is like your metabolic money is how I would put it. So yep, strength training, of course. And then just the more you can move pre and post meals can really also help to support your blood sugar regulation throughout the day. So if you're like right at a sedentary job, I'm like, can you get a standing desk? Can you take movement breaks every 50 minutes? That will really support your overall body function as well. And again, reduce stress on your body in that, the physical side of the bucket things. And then last one, which you talk more about, so I won't go into depth, but is the whole toxin load. Of course, we want to reduce toxin load on our a toxin burden on our liver, and then of course any of those things that could be endocrine disrupting, actually directly impacting hormone balance by disrupting our hormones. So those would kind of be like my main lifestyle things.
Absolutely. I love that. What about from a supplement and herb standpoint? Anything jumping out at you there in terms of what individuals can do to help address the root cause now?
So it's really hard for me because you know me in supplements. I am really hard to get any blanket recommendations because every day I'm creating different protocols. I've literally never put anybody on the same protocol, but I would say magnesium and calcium are a pretty good start. Magnesium, I would say you could get a lot of calcium through food, broccoli, bone broth. Calcium has been shown in actually a lot of research to reduce PMS. So I really like calcium, but you always want to pair calcium with enough magnesium because that helps it to be better utilized in the cell. Calcium on its own without an optimal balance of magnesium and vitamin K can actually stimulate more histamine. So typically we can do calcium through food. I sometimes will do calcium magnesium supplement with my clients, kind of depending on their full clinical picture. So most people are not getting enough magnesium though, so most people will benefit from a magnesium supplement. So I have like a whole, in my supplement dispensary, full scripts, like a whole minerals one that's free for people to see, and they can see which magnesiums I recommend. Generally magnesium glycinate, generally a dose around 300, and I've worked people up to 600 milligrams before their period and during their period to help manage PMS and period pain. So generally calcium from food. Most people could benefit from magnesium in supplement form. And then the other ones I would say, I'm actually a huge fan of vitamin E and phosphatidylcholine. And this helps stabilize the cell membrane, which help to combat it against inflammation. Vitamin E has been shown in research to reduce PMS and period pain, especially when paired with enough vitamin C, which I would really recommend through mineral mocktails, which that would be like you do vitamin C source, so usually like lemon juice with some coconut water, potassium source, and then a a sodium source like salt, like sea salt. So generally getting vitamin C a lot through food. So if you're eating the fruits, the veggies, you're going to get a lot of your vitamin C. And then I will do a lot of vitamin E supplementation and phosphatidylcholine. Phosphatidylcholine, again, is a compound, helps stabilize the cell membranes. Choline is also really important for liver function. And so we could also see that improve like liver detoxification. And then I would say B vitamins, generally I'm putting most people on a comprehensive prenatal or multi. So that's going to have the B vitamins. That's going to support progesterone production, especially B6, liver detoxification, so optimal estrogen detoxification. And then lastly, I guess your last two, I'd say zinc. I've been seeing a lot of low zinc. I really would never advise this supplementing on your own, but I will say use it a lot in practice and tailoring it to someone's lab because zinc can play a huge role in histamine clearance, huge role in hormone production, a huge role in detoxification, and a huge role in supporting the gut lining integrity. And then the last one is your omega-3s. I mean, my general opinion is if you're not eating fish 2 to 3 times a week, you should be on an omega-3. Like chances are there's just no way you're getting enough of it from other food. Grass-fed and organic beef has been shown to have higher omega-3 levels than conventional. But generally, if you're not eating enough, I would do an omega-3 supplement. And then vitamin A plays a really huge role in hormone health, gut health, detox, all the things. So sometimes I'll do cod liver oil with people because that will have the omega-3s plus vitamin A. But again, generally I'm fine-tuning these things because we actually test retinol with people. So I can fine-tune, like, actually, do they actually need more vitamin A, or do they actually need more vitamin, or do they just need more omega-3s, right? So this is where that individualization comes in. But I would say those are kind of like my main nutrients from a supplement standpoint. Does that make sense?
It does. And I really appreciate you sharing that because I know that you have a hard time sharing specific to like supplements or herbs and like that kind of thing. But that just gives such a full picture view because we really discussed like nutrition, movement, lifestyle factors that all go into this. But I feel like that's that other bucket in that category that really comes last. Like we need to look at what are we doing from a lifestyle standpoint, a light standpoint, a nutrition, movement, all of those things really fill the foundation first. But then supplements can be so helpful to add into that and support like really getting you to where you want to go in terms of solving these heavy, painful periods, PMS, all of that.
And I will cover some of my favorite herbs. I did forget to mention.
Yes, thank you.
So dandelion root tea, nettle root tea, some of my favorites because nettle root will actually really help to stabilize histamine. So if that is a potential issue, nettle root can be really, really helpful. And then I'll do dandelion root a lot of times to support liver detoxification. So those are some of my I love those. And then the other two that I'll do a lot of pre-period and post-period, this is like the 2 weeks before your period and during your period, this is definitely a clinical pearl, is I will do the ginger turmeric tea by Traditional Medicinals paired with the Traditional Medicinals red raspberry leaf tea. I'll have people put one of each tea bag in a cup and drink that 2 to 3 times a day because they're very rich in vitamin C. Ginger is very well studied for PMS and painful periods. So you actually could do, some people, especially because sometimes I'll do supplements as like kind of a Band-Aid while we support the root cause because, right, my goal is to get people feeling good as fast as I physically can. So I've even done ginger capsules with people to like really reduce inflammation just while we are working on like the gut, the liver stuff that may take a little longer. But just the teas, and especially the ginger, because it's a ginger turmeric tea blend, that turmeric is also a really strong anti-inflammatory. So ginger, strong anti-inflammatory, if I didn't cover that enough. And then the red raspberry leaf tea has been also shown to, support uterine contractions. It's very rich in vitamin C, which is most likely how it can also really reduce inflammation, support progesterone. So that's my little clinical pearl. And sometimes then like, if there's like a histamine liver stuff, I'll have them do like the red raspberry and ginger like two times a day, and then like the nettle and dandelion root in 1 cup like 1 time a day. So I will get like really playful is the word. In that way. I don't think they're in a sense like a root, but they just modulate things, if that makes sense.
Well, they help the body along, right? As we're supporting the healing process. Like we know that it can take months for the hormones to get on board with root cause healing, right? It's not like a quick fix. So to understand there are things that we can do during this healing process to support not only the body's healing, but also help you feel good in the process so that you want to continue to support the body healing. Like it really all goes hand in hand. And that's where physical therapy can come into, as I mentioned, of like dry needling and myofascial release and joint mobilizations. Like if you are experiencing active pain, like we can help you move out of that. And that's going to thus decrease stress on the body, which is going to further promote root cause healing. So it's really this cyclical, like we're looking at so many facets of the puzzle here. And that's why Ginny and I feed off of each other so well. We said we would keep it under an hour, and we're like about at an hour, which is not surprising.
Well, I always say too, I'm married to a physical therapist, and I'm like, it is the best. I'm like, I highly recommend being married to one because whenever you have like a physical ailment that you're like, can you just like work on this real quick?
Yes.
I will say definitely with physical therapy, it's definitely more immediate release,
right?
And then sometimes, nutrition and diet and lifestyle can provide. Now, sometimes, yes, even just one really great meal can definitely help with your energy and all that.
Well, as always, just an absolute joy chatting with you, Ginny. And I hope that today each of you listening have just had so many light bulb moments on like PMS, painful periods, and first and foremost, understanding they are not normal, like really understanding that fine line of like, yes, it's common, but it's also like mildly normal to experience just noticeable changes in your body each month, but not to the point that it's impacting your daily life and how you're going about your ability to work or to do school or all of those things, to parent your children, right? And so to also know that, this feeds into our fertility and to address them in a root cause format of estrogen dominance, inflammation, stress, detox challenges, right? Like all of the things that we covered today were just so helpful. So Ginny, is there anything else on your mind on this topic that you feel like we haven't covered that you want to throw out there before we wrap things up?
The last thing I'll say kind of ties back to the histamine and endometriosis piece of things. I wanted to just kind of put on like the symptoms of like histamine imbalances.
Yes.
I'll just kind of like read you out like, okay, the main, like a lot of the symptoms that can be tied to histamine, because histamine binds to so many different receptors,
Yeah.
have definitely full body reactions. So not only, yes, the period concerns of like the cramps, the heavy bleeding, the PMS, anxiety, irritability, but definitely also if you notice this peak around ovulation. So if you are having these symptoms around ovulation and you're PMSing, that could be very much histamine related, because histamine can increase when estrogen increases around ovulation. So that's always a really big clinical clue to me when someone's like, I'm raging, around ovulation, and then I'm raging again, PMS. I'm like, oh, there might be a histamine issue there.
Interesting.
Digestive concerns, because histamine is very active in our gut. Bloating after meals, loose stools, reflux, heartburn, gas or abdominal cramping. Now, there can be a lot of root causes here. That's why we run the GI map stool test to help really rule out and rule in what potential issues could be. And then skin concerns, especially if you're like itchiness, hives, eczema, just swelling, general swelling, flushing, redness, very histamine related. And then more of that classic histamine system, like that, just like always congestion, runny nose. Of course, if you have like allergies, eczema, itchy, watery eyes, dizziness also, because it can really impact our cardiovascular function, low blood pressure episodes, brain fog, fatigue, insomnia, and anxiety. A lot of mood issues really related to histamine, because it is also so active in our brain. So I wanted to put that out there, because histamine is definitely underrated, and I'm starting to see it over and over again with my women they think they're coming to me for like classic period pain, and then they're like, oh, actually I have all these histamine symptoms. And so we're really trying to get to the root of that. And then the last note I'll make about endometriosis, I always will give a plug for @napro_fertility_surgeon on Instagram, because endometriosis is such a full body disease, and sometimes it does require a surgical approach, but from a trained excision surgeon, not a surgeon who will do ablation. So if you're dealing with endometriosis, you may need to seek out the best case, and I've talked to many excision surgeons, and they are like, surgery is huge to excise the lesions well and really reduce risk of adhesions and scarring. But really at its core, endometriosis is an immune system, gut, liver, estrogen disease. And so it needs a full body approach. So it really does best when it's like the surgery combined with this kind of functional medicine, diet, lifestyle approach. So I just wanted to put that plug about endometriosis as well, since people will probably either have thought that they, have it, they've been diagnosed, to give them some further resources. And of course, that's what we do in our practice all day long, is figuring out what these root causes are. Is it histamine? Is it endo? Is it both? Because endo can actually worsen histamine. So there's that. And just like, what the heck is going on? I always say at the end of the day, like, how I think of it is like, there's like there's a pyramid. At the base of the pyramid is like what we do in our practice. The functional medicine work of like, the deep root causes, diet and lifestyle. Then like an upper tier of like maybe using conventional medicine support, like progesterone supplementation, low dose naltrexone. And then up there, then we have like excision surgery. I guess on my second tier would be like you're like in the middle with like PT. Like you could be like, you could be foundation or like a little bit of step above.
Right.
Like, do that in addition to the foundations. And then at the tippity top would be like, I don't even know what would be at the tippity top, like very severe. I guess surgery would be.
Yeah.
So that's kind of, if people want to think of it in that period cascade, because I don't want anyone to ever think, oh, I need to do anything only diet and lifestyle, right? And I shouldn't use the medication or those tools. But really, it's a hierarchy in the way we should think of using those things. So I'm done. That's the last thing I want to say.
And I appreciate you sharing all of those clinical pearls. And I'll jump off of that just to say, but also to not jump straight to the top of the pyramid, which is surgery, right? Because that is what often happens from a traditional OBGYN office, if they're just referred on to surgery with a specialist there. And it's like, well, physical therapy can help. Well, a functional nutritionist can help, such as yourself. Like today, I'm actually seeing this afternoon a patient for endometriosis, heavy and painful periods. So this is like so front of mind, like it's a new patient evaluation. And so I'm just really excited to jump into things with her. And I'm kind of her starting point from like the foundation perspective this time, of pelvic health PT, but I don't know yet. It's my first time meeting her. Is she working with a functional nutritionist? Should we pull you in, right? So it'll be really interesting to see kind of how that case flows. But that's just an example of where we're both having these kinds of issues brought to our practice often, but then we're also collaborating where, okay, do we start here? Where do we go from here?
Pelvic PT can be life-changing for people with endo. Absolutely. And so I think it's also, you know, a really big thing that I'm working with the NAPRA fertility surgeon, which is Dr. Whitaker. She has the Uterus Allies Clubs. Is we're really working on how to build your restorative reproductive care team.
Oh, I like that.
On your full care team, maybe a pelvic PT, a functional nutritionist, and maybe an endometriosis excision surgeon. You know, it's not one right way of doing things. There are just options, and it's about building your care team. Now, would I love for people not need a million people on their care team?
I know.
I would, but this is where we're at. So
right.
Human beings that need a lot of different tools. And so, just like for people to kind of think about it that way, instead of, again, there's one person that's going to offer all their solutions, because that's not fair to you or me for someone to go to you and think you're going to solve all their issues, or to me to I'm going to solve, you know, we can help a lot, right? But you may need to refer out, and I may need to refer out to you, right? And I think that's just so important for people to understand too.
I think that's a sign of a good clinician, because when somebody's like, oh no, I can do absolutely everything under the roof, it's like, okay, but can you do it all well? Like, you know, so if a practitioner, either Ginny or I or somebody else, is referring out, it's actually a sign of them being a really, really good practitioner, because they know their limits and also have good resources in terms of creating that full care team, which is really important.
Exactly. I love it.
Well, Ginny, where can people find you, continue to learn from you, work with you?
Yes, so so you can find me on Instagram at thewomenshealthrn.com. The is important. Same with my website, thewomenshealthrn.com. And how we work with clients is within our 4-month program. So if you are interested in working with us, that's where we do all of our in-depth functional medicine testing. We walk you through, like, if you're like, I have nowhere to start, I just like all this diet and lifestyle stuff, like, I also am such a big fan of it being a coaching program that, you know, you can know a lot of things, but what are you actually doing, and how can we help you do that? And how can we help you orient you to like what you should be doing based on your root causes, right? Because you could know a lot of things, but is it actually important for you personally, right? That's the most important part. So that's what we're really doing inside our 4-month program. And then if you go on my no, it's on my Instagram. So if you go on my Instagram and you like go to the link in my bio, I have lots of free guides. Like red flags if you're trying to conceive, and mastering your hormonal health. So really going through functional labs, cycle charting, foundations for nutrition and hormones, a gut health guide, and a postpartum and pregnancy guide.
Amazing.
So lots of free resources on there. And then, I think that's all my resources.
Awesome. Well, I will put that in the show notes so that you know where you can reach Ginny and her team. She does everything virtual, by the way, so no matter where you live, her and her team are able to work with you. And then I'll also put the link to my website for pelvic floor physical therapy, should that be needed for you. And I do both in person here in Sydney, Ohio, as well as virtual. So we are just so grateful to you for tuning in. And if anything jumped out to you from this episode, if you had any light bulb moments, please leave the podcast a review. Drop Holistically Well a review wherever you're listening. That helps both Ginny and myself know what stands out to you as a listener, and we can jump into even more topics to optimize your holistic women's health across the lifespan. Until next time, thank you and be well.